Hey guys, I'm going to do this simple move exercise. It's a FRC, functional range conditioning modification. So it's for internal external rotation. So the hip rotation, so the ability of your hip to rotate outways and inways. And most of us need a bit of work on that from all of our sitting and different exercises that we do. So this exercise we're going to work on internal rotation first together, and then we're going to work on external rotation. I'm going to show you both. You're not going to see my face for a lot of video. You're going to see my legs, but you'll be able to hear me and we'll go through that. Okay, so I'm going to pop up against, all you need is a wall and then something to put between your legs. It can be a yoga block, it can be a pillow, it can be a ball, whatever works for you guys. Okay, so I'm going to pop into position here and make sure you guys can see. Good. So we're in this 90 degrees. And then I want you guys to pick something. So I'm going to just use this pillow because it's what I have handy. And then we're going to squeeze our knees inside here. The further you are closer to the wall, the more hip flexion there is and the harder it is. So if this is really easy, then go closer to the wall. If this is too hard, then go a bit further away. But I'm just starting at about 90 degrees here. So what I'm going to do, I'm going to start walking my feet out while I keep the squeeze on this pillow. And you guys should be able to see, perfect, that my feet are out here. And then I get to the limit of where my hip, this is internal rotation, and it's whatever our limit is. Maybe you go out a couple little inches and that's it. Maybe you go out this far, depends on what you are. And so then if this is really, really easy, go closer to the wall. But finding there, and then we're just gonna find this little bit of stretch here on the outside, so the top of our leg and that hip here, okay? And so we're gonna hang out here. If you wanna do this fully to gain more range, hold this for about 2 minutes. So we're just gonna hang out here, nice and easy. Back is flat, allowing your back to flatten on the floor. Nice and easy. You can always inch out a little bit more as you go. Taking breaths here in the nose, out the mouth, keeping the squeeze on the pillow, ball, block, whatever you're using. Breathing in and out. Right. Another breath and out. Now we're going to do something called a Pails, or a contraction of the tissue you're stretching. So we are going to contract our feet into the wall and towards each other. So the wall is going to be our resistance. We're keeping pinned on our block, pillow, ball. We're going to drive our feet. So start pushing them inwards. So it's like I'm trying to bring them towards each other. We're going to start at 20% contraction. We're going to ramp it up 40, 60, keep driving in 70, 80, till you're driving in as hard as you can. So everything around here is contracting, our core is contracting, everything is focusing on trying to bring that inwards, engage, hold. We're going to hold this for 10 to 15 seconds. 5, 4, 3, 2, 1. Breathe. We're going to go right into a rails. Keep pinned on that pillow, block, ball, and open. So we're going to do the opposite. So all the tissue on the outside is contracting to try and open our feet and lift them off the wall. Hold, hold. You may find that this cramps. We want to hold this right away to 100%. Right away. 5 more seconds. Again, we hold for 10, 15 seconds. 4, 3, 2, 1. That's one set. Breathe. Now you might find you can actually go a little further out. It's opened up a little bit of range and you can do another set there. So that's internal rotation. For your hips, we're gonna now focus on the opposite, the external rotation. And this is a quite nice one for your external rotation. Same position. We're gonna take one leg at a time. We're gonna pop it up on here. I want the ankle, the foot past, so that we're not pulling and straining our ankle. And if you can't get your foot up here, go further away from the wall. If it's easy, go towards the wall. So I have pretty good external rotation, so I'm gonna go a little bit closer to the wall and we're gonna hang out here. Perfect, now I can feel a stretch. So this is going in my bum all the way outside of my hip here. And what you're gonna then do is we're gonna use our hands to push our knee passively towards the wall. So this is gonna block you, but I'm gonna keep pushing down. I get a little bit of stretch through that kind of upper hip and lower back on the side, and mainly the buttock and around the hip. So we're gonna hang out there. Again, if you wanna do this fully, hang out for 1 to 2 minutes. Really, really calm breathing in here and out. And breathing in and out. Let your nervous system relax, let everything calm down. We're gonna do, again, 2 contractions. So we're gonna contract the tissue that you're lengthening, then the tissue you're shortening, which is going to allow us to acquire and keep a range. So first we're going to start with our leg. This right leg, which we're using, is going to drive the foot into the knee and towards the wall. So this whole leg is going to try and drive towards the wall. So 20, we're going to ramp, we're going to 20% contraction, drive more, 40, 60, 80, everything you can. Your foot and your knee are trying to drive everything they can towards the wall. Hold that. You can create fists, you can radiate, you can tense the rest of your body, drive everything you can. Hold again, 10 to 15 seconds. 5, 4, 3, 2, 1, rails. Now, I want you to keep this here, but think of trying to lift your foot off. So it's trying to hover, come towards you. So I want all this tissue to really engage here. I don't want the knee to come. I want it to come from the foot trying to lift off. So keep your hand keep yourself true here. Hold right away to 100%, 10, 15 seconds. 5, 4, 3, 2, 1, breathe. Now, reset, and you can go further and find your new range where the stretch is. You might need to bring yourself closer to the wall. If this is really easy for you, then you can try the 90-90. Check out the video on Eat, Move, Thrive 30, so 90-90 hip. But otherwise, this is a great one when 90-90 is a little bit hard. Breathe. Or if you have a back issue, this is a perfect one. It keeps your back flat and not pulling on it, and what we're working on is just the hip. Let everything relax. Good. So repeat that on the other side. That is a modification of a 90-90. Work on an internal and external rotation. To do the full set, we hold for 1 to 2 minutes for a passive stretch. Then we contract, ramping up to our greatest effort, the tissue that we are lengthening, followed by the tissue that we are shortening. Then you repeat that sequence because you'll find that you open up 10, 15 degrees of range and go to that new range and work again. So I always tell people at least do a set of 2, but if you can, 3 to 5 sets, really work that tissue is awesome to acquire and open up new range, okay? I hope you guys enjoyed that exercise and we'll see you again soon.